scramble to develop a vaccine against the coronavirus is in full swing, of course.
Joining us now to talk about the latest on a potential vaccine and more on this pandemic is Dr. John Whyte, the Chief Medical Officer for WebMD and a former director with the Food and Drug Administration. Doctor, thanks for joining us.
Thanks for having me. It's always good to be with you.
Well, there's been a lot of concern that a vaccine is being rushed for political reasons. You know the processes in place for certifying safety. Does that concern you that somehow a vaccine that's not perfectly safe or effective, could get through the process?
We obviously have to have a safe and effective vaccine. I think part of the challenge is there isn't transparency. It's not really clear what's going on. You have the president saying it's going to be available shortly, and then you hear, new information that we heard today from the Food and Drug Administration that we're going to require 2 months of safety data. And that's a good thing. These trials are in 20, 30,000 people. We're talking from going from 20, 30,000 to 300 million. We need to know that the drugs are safe. But I also want to say we should celebrate innovation. We are doing things today that before took years that are now only taking months, but they're not explaining that. The vaccine technology has changed in recent years, and that's why we see these quick turnaround times. But I've been telling people it's like baking. You can't cut down on the number of ingredients. You can't, shorten the amount of time that you have to bake, or you don't have good cupcakes. And that's what I want to hear more about, exactly how the process is going. Nobody wants to inject something in their body where shortcuts were taken. I don't think that's the case, but I want to be sure that's the case.
Yeah, people don't feel like they know enough at this point.
Yeah.
Let's talk about the rapid tests. They're becoming more common, more popular, you could say. Some people criticize them for not being as accurate. How and when should they be used in all of this?
With the rapid test, we really have a trade-off between accuracy and speed. I wish we could have both. That's the PCR tests that take a long time or more accurate. And then these rapid tests, point of care and antigen testing, aren't as accurate. But here's where people have been using them wrong. Most of them were studied in people that we suspected might have disease. They weren't used as this mass screening strategy that you test everyone whether or not they have symptoms. We need to have more data on those type of tests, which we don't have. Most of the rapid tests really, again, are designed, a physician orders it because he or she thinks you may have COVID, either through exposure or through some symptoms, not as a general screening. That's why we're having so many false positives and false negatives. It's a challenge.
Doctor, we have about 15 seconds left. What do you think the next few months are going to be like as we move into winter? More people are indoors. You've got flu season. What is your prediction for what we should expect?
Yeah. If we don't practice the safeguards of hand washing, social distancing, and mask wearing, we're going to see cases go up. We know that indoors transmission is greater when we don't have good ventilation. So that's a big concern. Remember, everyone has to get their flu shot because you don't want the twindemic of flu and COVID.
All right. Dr. John Whyte from WebMD, thanks for your expertise. We appreciate you joining us.
Thanks for having me.